Hi, everyone. Welcome to MEDENT Minutes, the podcast that explores EHR optimization and how practices can excel in value-based care. I'm Megan Chapman, the Director of Marketing and Communications here at MEDENT, and today I am joined by Heather Miller, the VP of Partnerships and Strategic Alliance at Suki AI. And also here today, we have my colleague, Matt Del Favaro. Matt is a project manager here at MEDENT, and he's been working hard to get our new integration with Suki up and running. So first, I would like to thank you both for joining us today.
Yeah, awesome. I'm excited to be here.
Um, And yeah, I'm actually going to start with you, Heather, and chatting about that big buzzword, AI. So if we could just start there, can you just tell me a little bit about what is AI and how is it applied in healthcare?
Yeah, no, absolutely. So AI, I'm pretty sure if we went ahead and Googled top 5 words used in 2024, that would be one of them. It is very much front of mind for leaders and everyone, whether it's in healthcare or other industries. How I view AI is really it's a computer system that is able to perform those tasks that previously, we needed humans to do. So the example I like to give is my 11-year-old is absolutely obsessed with soccer. She loves it, she plays it. And so she loves the women's team. And so today, she can easily go on Google or Chat GPT and ask who are the top 2 scorers of all time for the women's national soccer team. She's going to have that answer in seconds. 15, 20 years ago, she would have to go to the library, spend hours researching magazines, newspapers, and aggregating that information together, which is time consuming. It's slow. So when you think about AI, it's really about, making and augmenting our workflow so that we're more efficient and we're quicker. And we see that specifically in healthcare. And, AI can help different clinicians, staff, nurses, doctors, alleviate that administrative burden that they're feeling. It speeds up, their documentation time, for example. It speeds up personalized care plans, things that we really look at as administrative burden. AI is here to augment that and speed that up so that they can really focus on, why they're in healthcare in the first place, which is really to take care of patients.
Yeah, and you know what? I say that all the time. I say, these our healthcare providers did not go to school for, technology. They went to school because they are passionate about helping, people, maintain good health. And so I think that the shift, toward technology, while it is very beneficial, if it's not used efficiently or in the right way, it can seem kind of like a burden to
Yeah.
to these providers who, let's face it, their passion is not in note taking and
No.
reading up on codes and all of that. Their passion is in helping the patient. That's their number one focus. And I think that's where we come in. We, Suki and MEDENT, we're not trying to make things harder for folks. We are here to help with efficiency and help providers be able to focus more on their passion, which is the patient. Now, I do think sometimes that, when folks, it's a big buzzword, everyone's talking about AI, and while it is generating a lot of excitement in the industry, I do think there's sometimes some fear associated with AI, thanks to some, movies out there that may be depicted as some, big scary robot. So I'm just wondering, what are the risks of AI? Should we be relying on it, or is it simply just another tool for practices? Is this something that, health industry should fear, so to speak?
Yeah, I definitely do not think we should be fearing AI. We should have a healthy dose of skepticism at all times, and that, you know, there are always risks when you implement or develop any sort of new technology, especially with AI. Some of those risks that exist are around hallucinations, of bias, of equity. We don't want AI to have that bias, right? And possibly only be available to those who have the resources for it. So we have really put, at Suki, we've put a lot of thought into a thoughtful design of our technology in order to avoid those hallucinations and avoid bias in our models. So specifically, when I talk a little bit about bias, we do not actually train our models using any identifying data such as age, gender, location, etc. And this is truly to minimize the risk of bias. The other piece, or the other question you asked, was around, should clinicians be relying on AI? And really the answer to that I have is Suki has taken the approach where we are here to augment the clinician's workflow. We are not here to replace them. We are not here to make any clinical decisions. We are truly here to take that administrative burden off of them. And so when we designed our workflow, those clinicians are going to be presented with those suggestions from the ambient conversation, and they're going to approve that content before it goes and sends right into MEDENT. And so this, gives that physician the ownership of being able to review those suggestions. They have the ability to edit them or just accept them if they're happy with the output. But we designed that review process to be very streamlined for them, so it fits well within their workflow and doesn't add any additional, steps for them.
Yeah, and I think, you guys, it's called Suki Assistant, if I'm right. So I think that's exactly the role that we need in healthcare, and that you're fulfilling is, this is not meant to replace, like you said, the provider or anything like that. Suki is an assistant, here to help maybe with streamlining the workflow, like you said, and also making some suggestions that are still ultimately up to the provider. Am I right?
Yep, that's spot on. Absolutely. Yeah, we're really here to be assistive, right? An assistant to the provider. And when you think about an assistant, it needs to be fit into their current workflow and make them more efficient, not add to their daily activities.
Yeah, for sure. And so with Suki, as part of someone's team, what are some of the benefits of using AI in healthcare, specifically Suki?
Yeah, absolutely. So the work that we're doing with MEDENT is really exciting because it's specific to embedding Suki into the MEDENT EMR. So what I mean by that is, in this first iteration, your users are going to have the ability to invoke a ambient session while they're in their patient room having that visit with the patient. Suki is going to listen to the conversation. There can be, family members in the room talking. So our tech stack was built to handle multiple speakers. And then we're going to actually generate a note after that session, and almost, immediately. So the doctor or the clinician is going to see the suggested note, and then from there they're going to, either accept. We talked about that workflow. They'll either accept the content or they'll edit it, and then it automatically flows directly into the MEDENT EHR. And the beauty of this is it not only just flows, is it actually goes into the right section within MEDENT. And that really is a differentiator versus some, other ambient note generation companies out there. There is no copy paste. It's going to automatically go into that right spot, so the clinician doesn't have to add anything to their workflow.
That's amazing. Yeah, and looking at that, my next question actually is, are there regulations that come into play when this ambient listening is taking place, when AI is being used in healthcare? What kind of regulations are there to, that come into play?
Yeah, there's a lot of discussion on regulations and legislations around AI. We see this all over the board in that regulations are trying to keep up with whatever new technology is coming out. And quite honestly, we at Suki are very much in favor of responsible AI and responsible use of AI. And so, we've partnered with other thought leaders in AI, not just on the tech side, as in the tech companies, but also with healthcare systems and hospitals and groups, to put together frameworks for using and deploying AI. There's multiple groups out there that are working on this right now and working with the government. Chai, Valid AI being two of them, and we're partnered with them also because it's really important that AI is used responsibly, and so we're working with them to come up with what that would look like.
And I should actually be specific here that Suki is specific to healthcare. Is that right? It was developed with healthcare in mind.
Yes, that
Yeah.
is absolutely true. We are 7 years old, and we were quite honestly born in healthcare, and we will stay in healthcare. So we are 100% focused on healthcare. We know that not only there's specific workflow language that goes along in healthcare, but also, there is a lot of rigorous requirements when it comes to security, right? And keeping PHI safe and secure. And so we've taken a very strong stance there to ensure that our customers are protected.
Yeah, and that's great, because a lot of times you'll see with AI something maybe not healthcare specific, and just the fact that Suki is strictly in healthcare, I think that just kind of adds to, not just the credibility, but there's certainly a nice level of trust there when somebody works in the industry and really is, like you said, in that language and understands these regulations that come into play and just how important and different and sometimes complex the healthcare industry is. So I actually wanted to have Matt chime in here a little bit about, why did MEDENT choose Suki as a partner for AI?
Sure. Yeah. No, we looked at a lot of different services out there. There are several similar services out there that offer this ambient listening. The benefit that Suki had was mostly was the integration. They have a very good integration product. They're going to allow the integration API that they have is pretty straightforward. It takes away a lot of the need to, as Heather mentioned earlier, the copy paste. So people aren't going to have to be doing a note in some third-party program. The note gets created in there. Now you're copying, pasting different pieces of that into MEDENT. With this integration, it's really just going to be like a few clicks of a button, and that's going to be it. So it's going to be, the integration is second to none that they have. They also have a lot of flexibility. This isn't like a one-size-fits-all type thing. They have templates. And with the templates that they offer, there's a lot of flexibility. And these templates are what are the building blocks of the note that's ultimately going to pull into MEDENT. And there's a lot of flexibility in there, so where we can include things that we know should be included or leave out things that don't need to be included. So there's a lot of flexibility that Suki offers.
That's
the other
great.
thing, yeah, and the other thing too is Suki is a well-established company. Heather mentioned that they've been around for 7 years. These other companies, and I'm sure some of them are great, but I don't know where they come from or how well established they are. Whereas with Suki, we've been working with them for quite a while now, building up this partnership that we have. And everybody there has been really great to work with. They have a obviously, a great product, and they're very accommodating. There's things we've talked about, things we're working on now, and things we're going to look at in the future once we've completed this integration. There's going to be some probably enhancements down the road. It's not going to be just we're going to do this, release it, and it's going to be the same, 5 years from now or whatever.
Mhm.
So it's great, and like I said, Suki is the company themselves. They've been great to work with. We at MEDENT like to have good working relationships, and Suki definitely provides that for us.
Sure. And actually just, I know this integration is being worked on, and this partnership is something that's new for MEDENT, and I'm just wondering in the longer term, so what will that Suki solution within MEDENT look like?
Yeah, so the goal of this is, of course, the goal of Suki is to allow providers to reclaim their time by having more efficient workflows. And keeping with that idea, the solution MEDENT is going to have is very simple. You're going to create a progress note in MEDENT just like you currently would, and then there's going to be a button in there. You're just going to click that button, and it's going to start the ambient session, and you're just going to talk to your patient. You're just going to be talking to your patient with as little distraction as possible, just a one-on-one conversation with that patient. And then when you're done, you're just going to click another button, review the note that Suki generated, make any changes as needed right within the Suki interface, and then click another button, and that's going to pull right into MEDENT. So it's going to be very simple, very simple to use. But ultimately, again, the goal is to just have a more efficient workflow that will allow these providers to reclaim their time, both their work time and personal time. Like I said, down the road, there may be some enhancements to that. There's things, as I alluded to before, we've talked about some enhancements down the road. Nothing set in stone right now, but right now what we have is, as I described, just basically clicking a couple buttons, having Suki listen on that encounter you have with your patient, and generating a progress note, and then you're done pretty much.
Yeah, so it sounds very user-friendly,
Yeah.
which I think is very important, obviously, for, our system as an EHR, and just all technology that the industry uses. Yeah, user-friendly is certainly something we like to hear and see. And Heather, I'm just wondering, how has Suki kind of evolved in these last 7 years? I'm guessing that you guys, the enhancements that you've made, it seems like there's an exciting future here.
Oh, absolutely. Things have evolved so quickly just in the last 18 months with the onset of, LLMs becoming more available, more robust, healthcare specific. Just in the last year, I'd say probably 18 months now, we've released the ambient note generation. So, that's what Matt was talking about, that magical technology that will listen to a patient conversation and produce a clinical note, and it pulls out all the information that we talked about dogs and family, and really only pulls in the clinical information. But with that said, we continue at Suki to add in features and skills that make us more, of an assistant, because that truly is our vision. Our vision is to be an assistant, not a documentation only company. And so with that, we've released in the last couple years the ability to do some coding. We can look at doing answering questions, dictation. We've also released multiple languages, and also the ability to have multiple people in the room. So you think about, pediatricians especially, right? My child's not going in by themselves. I'm there asking questions too. And we're able to discern who's who and what's clinically relevant. As we look to the future, it's about more skills. A few that we're working on right now is around referral letters, orders, generating pre-visit summaries, right? So telling the clinician what is most important before going into the room. And then form filling. So this is where, as we talk about administrative burden, the number of forms that clinicians have to fill out is pretty insane. And so with our ambient technology, we can listen to a conversation or even listen to a monologue of the doctor talking, and we'll be able to fill out a form for them. So all of those are future skills that we're working on, and quite honestly, in a year, I couldn't even tell you what we would be coming up with because it changes so quickly.
Yeah.
Like it's
Right.
so quick.
Yeah, no, absolutely. I mean, it's constantly evolving, constantly changing, which is both exciting and, like I said earlier, a little bit scary with how fast things seem to be changing. But it seems like, especially in healthcare, and especially with the folks that we partner with, everyone's right on top of it. And, it really is just kind of an exciting future that we have. And it sounds like right now we're starting with Suki as more of a, documentation assistant, but there are, as we hear in this podcast, there's a lot of room for enhancements and just, a lot on the horizon, I think.
Yeah, and when you think about it, it's documentation represents such a large percentage of administrative burden for the clinicians. And so that alone is, the stepping point, the foundation to decreasing that burden is tackling documentation. And that's the most exciting part about our partnership with MEDENT is we're tackling that first.
Yeah, and that's fantastic. And I guess my last question here is, we at MEDENT, we like to really, take pride in our support staff. And obviously, when you're working with technology, sometimes you run into some hiccups there. And so I'm guessing that probably another benefit to working with Suki. Is that support. It sounds like Suki's been a very supportive partner, very responsive and attentive. So I think that just kind of adds to exactly what we're looking for as an EHR company is that level of support.
No, that's absolutely correct. And, talking earlier about why we chose Suki over others, Suki clearly has that, they have the support that's needed to help support us and help support our providers that are using this service. And that was one of the major reasons for going with Suki, on top of having a great product.
Yeah, absolutely. So thank you both again for joining me today. And Heather, Matt, is there anything else that you guys wanted to touch on before we wrap things up here?
Yeah, I just want to say just real quick, one thing, whenever this kind of comes up, I'd say half the time people's thought goes to something like Dragon, that this is just another dictation product. And that's not the case. As Heather was talking about earlier, what the product actually does is more than what the standard Dragon product does. Which is just dictation. You're talking to your computer and it's typing out what you've said. And to clarify to those that maybe don't understand truly what the product is, and Heather did a great job describing it. I'm sure they would understand just hearing what she said, but just to clarify that this is just listening to a conversation, your patient encounter, you're talking with your patient. It's taking all that and generating a note based on that conversation. So this isn't just you going in and saying, telling the computer what to say. It's listening to that conversation. It's using artificial intelligence, creating a progress note that will ultimately be pulling into MEDENT.
Yeah, it's smart. It's smarter care. Mm-hmm. Yeah, I think is the distinction there. Like you said, it's not just, voice, I don't want to say recognition, but it's not just dictation, like you said. You're not dictating this note that's just then being transcribed. It's actually this ambient listening. It is listening and putting that note together for you.
Yep.
Yeah.
Yeah, no, it's an amazing technology, and looking forward to people getting to be able to use it.
Yeah, absolutely. And I guess my question, Matt, is, if I'm sure this is going to generate a lot of excitement with a lot of MEDENT clients. If someone is interested, are there steps that they should be taking now to, get on a list or something of that nature? Or how can clients start to act on that excitement?
Sure. No, absolutely. They can reach out to our support department. We have a process in place. So if somebody calls about this, we're documenting who's calling about it. So when the product is finally released, we'll be able to reach out to those clients that reached out to us and let them know it's available and be able to work with them to get set up at that point.
Great. Very exciting stuff here. And Heather, thank you so much again for joining us. It just seems like Suki is a great assistant, and we are very excited to finalize this partnership and integration.
Yeah, I just want to, thank you again for inviting me on, and really excited about our partnership, and have very much enjoyed working with all of you at MEDENT.
Great. Well, thank you. We enjoyed working with you as well. And yeah, we're very excited for the future with Suki.